Level of prevention. There are mainly four level of prevention. First one is primordial. Primordial level of prevention in that before emergence of risk factor of a disease, there is no risk factor in primordial level of prevention. The second one is primary. In primary, we can prevent the disease. Risk factor is present, but no disease yet. In secondary level of prevention, disease possibly started. In secondary, we cannot prevent the disease. Like if a person comes in OPD and tells sign and symptoms of disease, this is applied when disease is possibly started in body. Now we go for diagnosis and prevention. In tertiary, disease in progression or over. And if person comes and tells about suffering from congestive heart disease, now our purpose is to prevent complications in this person and prolong life of a person. Then what are the mode of intervention comes under the primordial. In primordial, health education is important. In primary, we two specifically two terms are comes like health promotion and specific protection we can give to the patient. In secondary, we the mode of intervention is in secondary level of prevention we can do early diagnosis of the disease and early treatment. In tertiary, we disable disability limitation or rehabilitation. Like some are examples for primary level of prevention that almost all vaccines are given are the examples of the primary level of prevention, like measles at given at 9 months of age. Like we also give a BCG, DPT, DT, hepatitis B vaccine, TT, rabies, post exposure and pre exposure. All are comes under the examples of the primary specific protection. But now, if we give the BCG vaccine in treatment for bladder cancer, that comes under the secondary level of prevention. Now, we can also, if we use the contraceptive OC pills, intrauterine device, sterilization, that comes in primary specific protection. Now, if we use contraceptive OC pills in PCOD, that comes under the secondary. Now, for some examples are for tertiary level of prevention. In polio, if we use the crutches, ठीक है. If in polio, if we instruct patient to for physiotherapy, that also comes under the tertiary. In this, both limitations and disability and rehabilitation comes. One more example for tertiary level of prevention is spectacles, contact lens. We prescribe patient spectacles or contact lens. So that's all about the level of prevention.